My husband Hugo and I came to the Institute in 1976. At that time, the Institute was known as one of the 40 institutes in the country that were university affiliated and had training programs for the developmental disabilities. And in addition, they had a small unit where an inpatient unit where patients were admitted for periods that varied from a few days to many months. In 1976, there was patient-related research, but there was no basic research, that is, in the neurological sciences. It just didn't exist. And one of the factors that the search committee was interested in was to recruit a person, such as my husband, to bring basic research to the developmental disabilities. And so my husband, in the early years, wrote grants to bring basic research to the Kennedy Institute. And he was fortunate in getting one of the 12 basic research grants that was funded by public law for getting research to the developmental disabilities. The earliest basic research was on brain disease and fatty acid metabolism in the brain. In addition, there were researchers who were developing the early search for gene abnormalities in patients who had either specific diseases of the brain, or they were also searching for markers for new diseases of the nervous system. At that time, there was very little known about many of the disorders of the nervous system. Neurology was in its infancy. It was in a period where they had descriptions of diseases, but they didn't have the true cause of the disorders. At the time when we moved to Baltimore, my husband recruited several of his researchers from Boston to move with us. And one of those researchers was Dr. Yasuo Kishimoto. And his expertise was in fatty acid metabolism. And at the time, shortly after we moved to Baltimore, the group in New York made the first discoveries of the fatty acid abnormality in brain tissue and adrenal tissue of patients with ALD. And Dr. Kishimoto was asked by the group in New York to validate their findings, because not much was known about very long-chain fatty acids at that time. However, Dr. Kishimoto was an expert in very long-chain fatty acids. And so he validated the changes found in the ALD postmortem tissues. And because of that interest in the very long-chain fatty acids by Dr. Kishimoto, my husband became very interested in developing tests that could be used during the patient's life. We wouldn't have to wait for the patient to die in order to prove the diagnosis, which was based on clinical symptoms. So in the early years, probably around 1979, we developed a test on cultured cells where we measured the very long-chain fatty acids in the cultured cells. And so we could give the physician a yes or no diagnosis as to whether the patient had ALD or not. But it would take 8 weeks or so for us to grow the cultured cells and do the analysis. So at a meeting in Greece, we met a researcher by the name of Joe Schulman, and he was at that time at NIH, but we had to go to Greece to talk to him. It was these days when you often would do some serious science discussions at meetings, and I believe it still happens today, when you don't take the time to go to Bethesda, but you go to Greece and you talk to physicians. So Dr. Schulman suggested that we take a look in plasma of ALD and controls and see if we could diagnose ALD by measuring the plasma fatty acids. Well, in the early years, I had looked in plasma, but I had looked at the cholesterol esters in plasma, which is a subfraction of the lipids in plasma, and I did not find a difference between controls and ALD. So when Dr. Schulman said, look again, I did a total lipid extraction, and lo and behold, we were able to distinguish between the plasma fatty acids from ALD and controls. So we had a very quick diagnostic test that proved to be validated over many thousands of individuals. In the early 80s, we started with a diet therapy for ALD. My husband and others always looked back to what works for other disorders. And we knew for phenylketonuria, PKU, that diet therapy was effective at preventing the brain malfunction in patients with PKU. So why not try a non-invasive therapy on ALD? We knew that the plasma very long-chain fatty acids were increased in patients with ALD. So let's devise a diet which reduces the very long-chain fatty acids in ALD. Well, our colleague, Dr. Bill Rizzo, had fed cultured cells from ALD patients with an oil which is called oleic acid oil, which is similar to the fatty acid that you find in olive oil. It's a highly monounsaturated fatty acid. And he found when you fed oleic acid oil to cultured cells from ALD patients, you could reduce the very long-chain fatty acids by half, by 50%. And so we started in the early 80s, based on that result, we started a group of ALD patients, mainly adults with ALD at that time. We started feeding them this highly purified olive oil, which contained only that oleic acid oil. And we found that we could reduce their very long-chain fatty acid levels by 50%. When my husband Hugo arrived at the Institute, he brought with him some of the programs that he had started in other institutes for the mentally disabled children. And one was the neurobehavior unit, which he established with Mike Cataldo at the Kennedy Krieger Institute. And as you know, many children have been patients on this at this unit and have it has bettered their lives tremendously. During the time of Hugo's tenure at as head of Kennedy Institute, many new techniques were developing to image the brain of patients, so that very early on, Hugo and his staff realized that they should purchase some of these, or institute the purchase of these magnetic resonance imaging instruments in order to see the fine structure of the brain, to try to understand what the patient's disability was at the brain level without invasive studies. So the MRI Center was founded during this time, and it continues to be a huge factor in the care of children here at the Institute. In the early 80s, my husband, Hugo, met Dr. Andreas Rett in Austria. And Dr. Rett showed some of the patients with, at that time, Rett syndrome, named after Andreas Rett. And these patients had very typical movements. They had repetitive movements of the hands, and you know, to an untrained eye, you could have missed it. So my husband believed that all neurologists, pediatric neurologists in the United States were missing the diagnosis of Rett syndrome. So he organized a meeting a workshop at the Kennedy Institute, where he invited Dr. Andreas Rett, and they brought 2 patients with Rett syndrome all the way from Austria. They invited many neurologists and pediatric neurologists to this workshop, including many fine pediatric neurologists from all over the country. And they hosted this workshop, and these neurologists and pediatric neurologists went back to their practices, and they identified many patients with Rett syndrome. So that by the time they had the next workshop on Rett syndrome, I believe there's a picture of many patients and their families in the Kennedy Krieger lobby. There are probably 100 individuals, and perhaps at least 50 patients with Rett syndrome were there. My husband approached the Kennedy Foundation for some money to help fund some young pediatricians, pediatric neurologists, and basic scientists in working at the Institute on the neurodevelopmental disorders. And the Kennedy family funded 6 fellows for a period of, I believe, 2 years. So it gave these young researchers a jump start in their careers by giving them financial help so that they would be interested in working on brain disorders. So there were 6 fellows. There was Winston Chen, Frank Brown, John Gerhardt, Oras Turco, Mark Badshaw, and George Sack. And they were very productive. And looking back at all the papers that where their names were on these published papers on their specific fields of interest. I believe that Kennedy fostered the careers of these individuals, and then they went on to be senior researchers in the field. They didn't all stay in this area. They went on, and that's the whole purpose of this idea of training individuals to work in the field of developmental disabilities. And it kind of spreads the research from the key centers to other centers around the country. The first brain disorder that had newborn screening was developed by Dr. Guthrie, and that was the screening for phenylketonuria, PKU. PKU affects about 1 in 20,000 births, and without identifying PKU patients at birth, they go on to develop brain disorder. But if you identify them early, you can prevent this brain disorder. So using that as the model, my husband and many other researchers believe that newborn screening is the key to preventing brain disease in these inherited metabolic disorders. So currently, around the country, there are about 25 disorders that are currently screened for. Unfortunately, ALD is not one of the disorders which is currently in the newborn screening panel. And one of the reasons was that there was no test, there was no newborn test. And we advocate using the current vehicle of newborn screening, which is the Guthrie blood spot. That is a blood spot in filter paper that is collected on every newborn about 1 day after birth. So we wanted a test that we could use on this dried blood spot that's collected on every baby, but there was our test had not been developed until about 5 years ago. So we've been 5 years in developing this newborn screening test for ALD, and we're at the point now where we're moving that test to some of the larger states like New York, and our colleagues at the Mayo Clinic are doing 1,000 samples a week currently anonymously to make sure that the test works. And our group assayed 5,000 newborns from the Maryland screening. And we went through that first 5,000 and found no cases of ALD. So we've shown in the 5,000 from Maryland that the false positive rate is very low. And the Mayo Clinic is finding that in their first 15,000, they have no positive either. So this test is now ready to roll out nationally. And it's our hope that every state in the United States will pick up ALD newborn screening. We expect to see about 1 in 20,000 with ALD. The tandem mass spectrometry is a wonderful tool for screening for lipid abnormalities in the nervous system. The Institute has grown in size, and also the Institute has become known for being a leader in research on inherited disabilities, as well as treatments for all types of brain disease.